Use the enclosed hand sanitizer packet to wash and sanitize your hands. Once your hands are dry, put on the clean gloves. Carefully remove the old dressing, making sure to be gentle on the patient's skin and try to avoid skin irritation. If instructed to do so by the VAD coordinator, use an adhesive remover to help remove the old dressing. Make sure to keep the Driveline still while performing this procedure. Examine the Driveline exit site and the dressing. Look for signs of infection or skin irritation, including redness, tenderness, and/or drainage. Once the old dressing is inspected, discard it. Remove the gloves, turning them inside out, and discard. Now that the old dressing is off, we will clean the area using sterile technique. Tear open the bottom label where it says "Tear Here" and remove the hand sanitizing wipe and sterile gloves in a paper wallet. Set the sterile gloves aside. Thoroughly clean your hands with the sanitizing wipe and let dry completely. Unfold the drape once more and lie flat. Open the sterile field by pinching the white tabs affixed to the dressing that say "Pinch Here." Be careful not to touch the inside of the drape as it is sterile. You may touch an inch around the outside edges if you need to reposition the drape. This is the Sensitive Skin Driveline Management System Kit. Step 1. Take the sterile gloves and the paper wallet previously set aside and unfold the paper wallet so that you can access both sterile gloves. Be careful not to touch the inside of the paper wallet. Place the gloves on the appropriate hands using sterile technique. Pick up the first glove by pinching the folded area on the cuff. Be careful not to touch the outside of the glove. Put it on your opposite hand, taking care to get your fingers and thumbs in all correct spots. To pick up the second glove, carefully tuck your gloved fingers underneath the cuff. Hold the glove with the opening pointed towards the ceiling. Keep your sterile thumb out of the way and pull the glove on. Once you have the sterile gloves on, be careful to only touch the sterile items inside the kit. So far, we have removed the old dressing, prepared our area, and put on sterile gloves. Now, Step 2. In the pocket labeled Step 2, you will find 3 povidone iodine sticks. After opening the package, take out one of the swab sticks. Starting right where the Driveline comes out and moving out in a circular pattern, clean the 4x4 inch area under the dressing. Make sure to clean all the way around the Driveline exit site, including directly under the Driveline and right where the Driveline comes out. Be careful when handling the Driveline and avoid pulling on it and moving it too much. Do this 3 times, using 1 stick each time. Let it dry completely. Step 3. In the pocket labeled Step 3, you will find a skin protectant wipe called Kevlon. Open this package and use this to wipe around the border where the adhesive will go. This will help to protect the skin and make the dressings stick better. Allow to dry completely. Step 4. In the pocket labeled Step 4, you will find 2 4x4 gauze with slits. Look at the diagram on this pocket. Slide the gauze under the Driveline until it is snug against the exit Driveline site. Next, take the other 2 4x4s without the slits and place them over the gauze with the slit. Next, take the long strip of tape, leave the backing on, and separate it into 4 even strips. Remove the backing and place each piece over one edge of the gauze. Place the bottom tape under the driveline. Once the main part of the dressing is in place, then take the remaining fabric tape and slide it under the driveline and over the main dressing. Don't pull the backing off this dressing until it is snugly against the driveline. Then remove the backing of this piece by grasping the flaps and removing one side at a time. Remember to make sure to change the anchor at least every 7 days or sooner if it is peeling off. To place the anchor, line it up on the skin, making sure it is not too tight or too loose. Remove the backing and press into place. Once it is in place, double check that it isn't sticking up, but it is still loose enough to fit 2 fingers underneath it.